This is Dr. Peter Breggin, and this is another in my Simple Truths about psychiatry. And the subject today is that psychiatric drugs are much, much more dangerous than you've ever been led to believe by the doctors who are prescribing them.
My name is Peter Goetje. I'm a director of the Nordic Cochrane Center in Copenhagen and professor of research design and analysis at the University of Copenhagen.
I'm a chemist. I love scientific method, always have. When I worked for the drug industry, science was completely abandoned.
My name is Gwen Olson, and I am the author of Confessions of an RX Drug Pusher. I'm a 15-year veteran of the pharmaceutical industry, and I left in the year 2000.
I genuinely believe that if most people knew how dangerous the psychiatric drugs really were, most people would never start on them. And I also believe that if most prescribers had even the faintest idea how dangerous they were, they'd stop prescribing them.
The pharmaceutical industry doesn't want to cure people. You need to understand, specifically when we're talking about psychiatric drugs in particular, that these are drugs that encourage people to remain customers of the pharmaceutical industry.
So, that's a business model, okay, that allows you to give a drug to a person for life. These drug companies that I was interviewing with had no problem telling me, look, we design drugs based on treating symptoms. We don't cure.
What was found was the information that activists and other researchers have known for decades, was that antidepressants are no more effective than placebo, no more effective than sugar pills. But yet there are over 44 million people that have been taking these antidepressants, and a large number of them people that have mild to moderate depressive episodes.
There's two words that a psychiatrist fears. Two words. Prove it.
In fact, they proved that the antidepressants were not effective in anyone with the exception of some of the most severely depressed patients.
Much of what the drug industry does fulfills the criteria for organized crime in US law. And they behave in many ways like the mafia does. They corrupt everyone they can corrupt. They have bought every type of person, even including ministers of health in some countries.
They ran out of symptoms to treat. So what did they have to do? The next level of drug advertising is inventing disease. When you run out of symptoms, you don't have any more clientele to market to. So you have to invent disease. And with psychiatric medications, you can invent diseases all day long.
I know this because I've been a medical expert in dozens of lawsuits against drug companies. I've looked inside drug companies and seen what they're really doing. I was appointed by a court in Indiana to be the scientific expert for over 150 lawsuits against Eli Lilly, suits alleging that the drug Prozac had caused violence, suicide, mayhem, mania, and psychosis.
Many of these drugs affect the brain, and they may affect your cognition, your memory, and all these things. And we actually don't know how these drugs interact with each other. What we do know is that all drugs have many effects in the body, and some of them interact also in their metabolism.
Especially these newer antipsychotics, so-called second generation or atypical antipsychotics, they're even worse than the older ones in causing a metabolic syndrome. People get obese, they get diabetes, they get pancreatitis, they get elevated cholesterol, blood pressure is off. And then, since the drugs also cause heart arrhythmias and in combination with other drugs do even more cardiovascular damage, that's one of the ways in which people are having shortened lifespan on these drugs.
Hypnotize the masses. Hypnotize them and drug them, and get them into their psychiatrist so they can swallow the next Cymbalta or the next Prozac.
So what we need in the coming years is to take far fewer drugs than what we do currently. If we did that and we were careful, then we could live longer and live better lives.
Now please, don't just stop taking your drugs, because the ultimate tragedy is that coming off of them can be catastrophic. People can get suicidal, they can get violent. Some of the drugs, you can get seizures. Some of the drugs can drop your blood pressure if you're coming off. So get good information, get some good clinical supervision, work with your family or friends. The shorter time you're on psychiatric drugs almost certainly means that you'll have a better quality of life.
So I would like to ask you to please self-educate, be proactive, and share the information with others. The next victim could be someone that you love.